A stroke can have very serious effects on a person's life and can change how the body works in many ways. One common consequence is difficulty controlling the bladder, which is called urinary incontinence. Urinary incontinence means the body has trouble holding in urine, so it can leak out before reaching the bathroom. This problem affects over half of people who have had a stroke, but it is still not talked about very much. The most common type of urinary incontinence after a stroke is called urge incontinence. This is when the bladder is overactive. It means you may feel a sudden and strong urge to pee, and it can be hard to hold in the urine. So how does this happen? The act of going to pee is controlled by the brain and the bladder working together. The brain sends messages through the nervous system to tell the bladder when to hold in urine and when it is time to empty it. After a stroke, parts of the brain that control this process can be damaged. As a result, the bladder may squeeze too often or at the wrong time. This can cause a sudden urge to pee, needing to go more often, or leaking urine. This is common after a stroke because the connection between the brain and the bladder is not working as well as it used to. Some people may also have bladder problems because of other challenges after a stroke. For example, they may have trouble walking or getting to the bathroom in time, or communicating that they need to go. This is called functional incontinence and is also common after a stroke. Others may not notice or understand that they need to go to the bathroom. This is called impaired awareness incontinence. It can happen if the stroke affects areas in the brain involved in thinking and awareness, causing memory loss, changes in reasoning, or denial of illness. In this case, a person may not respond to their body's signals that they need to go to the bathroom. Finally, bladder problems may also be linked to constipation. To learn more about constipation management after a stroke, please watch our video, Constipation After Stroke and Management Techniques.